Hello America, this is Nick and Buras with a Moderate Minute. Today we're going to be talking about healthcare and health insurance. Recently you probably heard a lot about socialized medicine, the Affordable Care Act, and Medicare for all. I'm going to talk to you about all of these from my personal experience. I was in the U.S. Navy, and as a veteran, I was entitled to go to a doctor, to a dentist, while I was in and just get taken care of. Even if I needed surgery, a medication, no co-pays, I just go, get things done, and I leave and I go back to my barracks. Everything like it never happened before. There was also a time in my life where I was unemployed and I had no insurance whatsoever. I played rugby, I tore my Achilles, and I didn't have money to get an MRI. I didn't have money to get surgery. So for 3 years, I basically let it heal on its own, and it never healed correctly. Now I work for corporate America, and I do have insurance. Of the three, obviously, the one I had when I was in the military would be ideal. And that one is probably the most comparable to socialized medicine. You go in, you get treated, you are getting health care. It's not health insurance, but it's health care. Doctors are treating you, nurses are taking care of you, and everything is paid for by the government. The next situation obviously was the worst, where I had no health care whatsoever. And this is also was the case for my parents. My mother was a waited tables, no health insurance there. And when the Affordable Care Act first came out, I thought that was great. Now we have more Americans who don't have insurance now being covered, and now they can get treatment and they can go to the doctor and they can get the health care that they truly need. The unintended consequence is that someone had to pay for this additional coverage, and that was the existing healthcare carriers. So what had happened then was everybody's rates went up. My rates went up, the policeman rates went up. The teachers were upset because now they're taking home less money than they were before, because now they're paying more into their healthcare costs. So that wasn't the ideal either. And then Medicare for all is just saying, well, we're paying Medicare for the elderly population, let's expand it to everybody. Again, that is not health care, that's health insurance. So health insurance, to negotiate with the healthcare companies, just adds that extra layer of payments and extra layer of bureaucracy. So if we were to go to a national system where everyone was covered the same, and I do believe that that is something we should do, we should go where it's health care for all, not health insurance for all. Thank you. This has been a Moderate Minute. Please like, share, and leave comments below.